Dear listeners, welcome to Faces of Digital Health, a podcast about digital health and how healthcare systems adopt technologies. I am your host, Tjasa Zajc, and following up on our previous episode about data breaches and cybersecurity in healthcare, you will be listening about GDPR, General Data Protection Regulation, rights users have regarding their data, and the upcoming MDR, Medical Device Regulation, which takes effect in May 2020. In general, medical devices are products or equipment intended for medical use. These include long-term corrective contact lenses, surgical lasers, defibrillators, hearing aids, diagnostic ultrasound machines, and hip joint implants, to name just a few. There are three classes of medical devices: Class 1, Class 2A and 2B, and Class 3. Classification depends on the intended use, where medical devices in Class 1 have the lowest perceived risk for health, those in Class 3 the highest risk. The upcoming MDR also defines software which is intended for medical purposes to be a medical device. I spoke with Jovan Stevovic, co-founder and CEO of Chino.io, which stands for Cloud Health Interoperability Platform. Enjoy the show and do find the recap on our website www.facesofdigitalhealth.com. The direct link to the recap is in the show notes, where you will also find some useful links of materials from Chino.io. Jovan, for a brief introduction, in one of your posts on Medium, you wrote that you were always interested in health data security, which is why in 2014 you founded Chino.io. Can you share the background of the story, where the interest for health data security comes from? It's quite a specific thing.
Yeah, sure. I started with my PhD, actually my master, and then PhD with a company in Trento in northern Italy. I started working on different projects in healthcare, and one of the most important topics and common for every project was privacy and security. Then I started my PhD researching how to invent new methods to share medical records. Then I started my experience in US, in HP Labs in California, when I met great researchers and also worked with them on this topic, how to share medical records between Europe and US. And I got passionate, and Chino, which is an acronym for Cloud Health Interoperability Platform, was actually created during my PhD work back in 2012, I think. Yeah, I think it was 2012. And later on, when I started this entrepreneurial activity, I just continued with my colleague Stefano this thread of work, let's say, on privacy and security in healthcare, and we founded Chino.io, the startup that simplified a lot what I was doing before, because during my PhD I was doing very complex stuff. We simplified a lot and then started a service for application developers in digital health space to help them on security and privacy topics.
You mentioned that you were dealing with the exchange of data or health records between Europe and the US. What were the findings regarding the possibilities? And, we talk about the interchangeability or interoperability of systems inside the US or in the European countries, but not between the US or other continents.
From scientific point of view, I was researching methods and differences in regulations and how to provide a platform that can support both regulations on both continents. But then that was in 2010 up until 2014. That was kind of a visionary work. HP Labs in California, they were interested in that because they are a global company and they want to do research in that space. Of course, again, visionary, we found new protocols, new processes, new technologies to share these records. But at the end, the practice and the truth is that we are struggling in connecting single hospitals in at least in Europe, but also that's also very true in US. I mean, the interoperability still is a huge issue, but it's not a technical issue. That was my main conclusion after my PhD, and that's why I also started a startup that focuses on something more specific. So helping application developers out there developing single apps or single services, but not really working in this domain of connecting hospitals and big institutions, because that's not really, I mean, what I discovered is not really a technical issue, but it's mostly a political, financial problem that has to be solved by larger organizations and by public authorities.
Let's clarify some terms that are used when it comes to data protection. What's the difference between cybersecurity, data security, and data protection, or data privacy?
Well, yeah, it's a good question. Actually, there are those are different topics and different categories. The General Data Protection Regulation, GDPR, focuses on data protection. The most important advancement that GDPR introduced is the concept that users, they have the subject rights, data subject rights. So they have some rights that can exercise towards data controllers and data processors. So companies taking their data, storing their data. Though this is data protection because those companies, they are obliged to protect the data and provide to users functionalities like right to be forgotten, data portability, right to object, right to restrict the processing, and so on and so forth. Data privacy is more is considered more like a human rights. We have seen recently with Edward Snowden, Cambridge Analytica scandals, violation of privacy. But this privacy violation doesn't mean the violation of data protection or data security, because privacy is, when people monitor you too much, that's the privacy violation. And then data security is typically focused on data encryption, storage, management of data, while cybersecurity is something much broader, includes many subcategories of security. It can be related to application security, to penetration tests, to firewalls, to cyber attacks. And there are many companies, for example, that do cybersecurity, but they don't do data security or data protection at all because they focus on some specific cybersecurity threats. In the medical space, we have seen, for example, a big issue for medical devices and IoT space, because those devices are difficult to protect. They can be cyber attacks to pacemakers. And again, this is connected to protocols and how these devices work, but not related to actually data security or data protection at all.
These topics all intersect, right? And it's sometimes maybe hard to differentiate between them if you're not an expert. For example, I just read that a pharmacy in the UK was fined £275,000 pounds because they were not storing documents from patients properly. The papers were water damaged and were not held securely, as the area could be accessed by residents living in a nearby flats. This is basically an issue that would fall under data security, but the fine was under GDPR.
Yes, right. So I would say, from this analysis, very, very funny case, by the way, that this is malpractice related to storing and holding this data. So data security and data protection, because they didn't provide some guarantees to their users, their customers, to protect this data and to provide them these functionalities like data subject rights that I was mentioning. So I would say, this falls in this category, and therefore, yes, GDPR is the relevant law to provide a fine to people that don't follow those practices. Yes.
We often read about the fines under GDPR. two questions here. One is, what was the highest fine that you came across in your research, or just, daily looking at the problems that are arising? And the second is, do people actually execute their rights that they got through GDPR?
We observed initially very, very huge threats because GDPR promises 4% of turnover, global turnover. So for big companies, this can be a huge amount of money. But actually what we have seen in the last year were the first fines, and some of them were quite big, not at that level because no companies were found to be really that much guilty in processing the data. But some huge fines happened in Germany and Britain. In Germany, we have seen fines, for example, for property owners, big companies owning properties, they were fined a lot, and telco operators were fined a lot money. And in this case, for example, a telco operator was the first also somehow case in which a person triggered this lawsuit because his privacy was violated. As a summary, in 2019, we have seen first fines, some of them quite big, some of them quite small. In healthcare, we had a few fines. Still, I perceive that the companies, they can have the risk of being fined not proportionally, because there is still the need to harmonize data protection authorities across Europe to say, okay, this is really bad, this is, medium violation, this is a small violation.
So if I understand you correctly, the consequences of compliance differ from country to country because of different regulators in charge.
Yeah, definitely. That's the case. I would say they differ also by single regions in single states. For example, like in Germany, a federal state, or they differ from sector to sector somehow. I have this feeling that, for example, these cases in Germany, the fines were not really proportionate in some cases, just because the company was somehow, perceived as a bad guy out there. So I feel that there are still, we still lack harmonization across Europe, but also across, in single states for specific violations, to say, okay, this violation brings me to this risk, and this violation to that. There is still lack of rules, let's say, clear rules.
Right before GDPR was implemented, I had a discussion with a lawyer because at that time, everybody was wondering in 2018, how is this going to look like? Will companies comply? And he was a lawyer in Germany, and he said that in Germany, companies are very well prepared because data privacy and data protection has already been taken very seriously, even before culturally. So from that perspective, what's your estimate? Has anything changed with GDPR or not really? How is the landscape looking in digital health in Germany in that perspective?
My experience by working with a lot of startups, SMEs, and some larger companies across Europe, all European states. We work with companies from Portugal to Romania, Ukraine, so all countries, to Finland and Italy and so on, is that there is not really the best guy and the worst guy out there. It really depends from company to company. It really depends from this personal, sensitivity of people to this topic. In Germany, it's not true that companies are more prepared. I just think they are more conservative. But when they realize that they need to do something with this data. They need to innovate. And then when they face this reality, they still struggle like the others. Small companies tend to skip some rules at the beginning, but then this is typically a technical debt. So when you develop an application for patients and you just skip some requirements at the beginning and you want to implement them later on, then this is a technical debt. And I have seen many companies having these technical debts. They had to fix their applications later on. We have seen, for example, in Berlin, a couple of startups that ended up on newspapers for violating privacy in a really simple and really, just simple and ignorant way, because they use some tools that they shouldn't use. So really basic requirement.
Could you perhaps be a little more graphic in the sense that you could give us some examples? What are the most common problems or questions customers turn to you for, and what are the most common issues that you identify?
Well, the main issue is that there is ignorance about these requirements. So there is GDPR law, but then what it really means for companies developing digital health solutions, nobody knows really, except lawyers and security experts like we are. So the first challenge for us is educating those entrepreneurs and companies what they really need to do to make their application compliant. The first thing they start asking is, what data do we collect? What do we need to do for the data we collect? And frequently they try to anonymize the data, but in a way that is wrong. So they just remove name and surname and they say, okay, our data is anonymous, but they still, for example, collect email of patients. And the first challenge for us is saying, okay, if you do that, it's not legal. It's not okay. So this is the first step with let's say smaller companies, entrepreneurs. While with larger companies, I see they struggle with the processes, because they have lawyers internally and they have quality experts internally, but bringing them together and bringing this new knowledge of data protection in cloud space for health applications, that's the main challenge. For example, we have seen, as I mentioned, 2 companies in Berlin recently appeared on newspaper for violating privacy. They used both some analytic tools, some tools that track which apps are downloaded in which countries, on which phone screen, on which phone operator, and so on and so forth. Those analytical tools were violating their privacy policy, basically, and their consent practices. So those companies were violating privacy for some, I would say stupid, very simple requirements. And again, what is missing is clear knowledge that every single tool that you use for your application, you need to check the privacy policy and terms and conditions of that tool, and you need to follow a process. First, you need to take the consent of users and then use those tools to collect this data and inform them before collecting the data. So they didn't follow that simple step, and they ended up on newspapers with a very bad return of image, reputation, and so on. So I would say education is the main challenge.
To which extent are you noticing that consent of users is just trying to be forced upon users through terms and conditions and privacy policies? Often feels that as a user you don't really have a choice when it comes to data processing, and of course we don't know how data is stored. That's for the providers to take care of.
Still, privacy policies and terms and conditions are very complex, so we need to work on forcing companies to simplify them, to simplify the language, so people can understand them in few bullet points, understand how this data will be processed and collected. There are some funny statistics, and that the Facebook privacy policy is the most complex piece of text, even complex than Shakespeare. The complexity is a huge problem. Then consent should be, explicit, should be simple, should be understandable by people, but not many companies are applying those requirements in defining the consent, the checkboxes that you check when you download an app or start using an app. So, but we need to work on that. First of all, we need to implement those in properly. As I said, those companies that were on newspaper, they didn't implement that process properly. So first, consent has to be asked, and then the consent has to be shown and recorded properly. And we have seen, for example, with mobile phones in the last years with Android and iOS, they implemented a simpler, smarter, better consent management. So every time now you start using an app, it asks you for this specific consent, for this specific feature to record your phone, to record your camera and so on. When you start using, that's much better than it was before.
GDPR is very broad. It doesn't refer only to healthcare, but we're talking about healthcare, and you're also helping companies be compliant with HIPAA. So just briefly, can you outline a little bit the difference between GDPR and HIPAA?
The main difference is that GDPR is generic, as the name says. So it affects everything, every single sector out there, and it defines general principles. While HIPAA was defined in 96 and evolved over time, defining very precise requirements for healthcare. It's a specific healthcare law. So the difference is basically that in US, we have much more knowledge, much more established market for service providers, lawyers, consultants who can assist companies to develop secure applications. I was recently talking with some startuppers that created their applications and startups in US, and they said, it's much more established market. There are higher prices, but whoever works in this space, including investors, they know what has to be done to bring an application to the market in a proper way and establish relationships and commercial, activities with all stakeholders, hospitals, insurance payers, and so on. While in Europe, GDPR is still generic, and we still see fragmentation, problems for developers, but problems also for bodies that needs to engage with developers and service providers. There is still work to be done on GDPR to make it more concrete for healthcare specific sector, and to create specific rules on data security and data protection.
If I go back a little bit on the issue around terms of services and consent and privacy policies, let's say you're a user that really wants to use an app, and you actually take time to read the privacy policy and terms of use, and there's something you don't agree with. What can you actually do so you can potentially still use the app?
That's an interesting question, and refers to a specific requirement to consent, for example, which has to be incremental somehow. So the main feature of an app, for example, let's say an app is for diabetes control. The main feature of this app should be always available, even though you don't accept to be, for example, profiled, to be subject to marketing activities, marketing campaigns, and so on. So basically, the consent should be granular, should have different checkboxes, and one should be mandatory, for example, service provisioning, but the other should be optional. And if the service provider of this application doesn't allow you to use the app without accepting profiling, marketing, and so on and so forth, you should be able to ask to this provider to update their consent, and potentially to trigger a legal process, legal lawsuit against this provider, because this provider is not following GDPR. GDPR says that the consent has to be granular, and the main functionality should be available without, being profiled and subject to marketing.
That's good news. The only question, I guess, is how many people actually do that?
Well, in this case, yeah, I agree totally that this probably nobody triggered this requirement in the last year or 2 year and a half of GDPR. But I think many people trigger the request for right to be forgotten. You can find online, templates. You just need to fill this template, and if you can send it by post or by certified emails that we have, for example, in Italy, to the company, and they are obliged within 60 days, if I remember correctly, to delete all your data. And if they still send you some emails or contact you later on, you can basically sue them. So I think this right to be forgotten has been requested by many people in the last 18 months or so of GDPR.
This year, a new law is supposed to go into effect, and that is medical device regulation. What are your expectations regarding the law? Many organizations are pushing for a delay in putting the law in action. I guess when a new law comes in, there's always going to be somebody that's going to say that the industry is not ready. It was probably the same with GDPR. So what are your expectations when it comes to MDR?
We have created some marketing material that people can find on our website that you can download. And we have seen that many people are interested in this topic. Also in digital health, because MDR affects now digital health, every kind of application in healthcare space. What we have seen is that somehow for MDR, people are more prepared or more aware that this is a huge obstacle in terms of certifications. I think when people hear that you need to have a certification, then they are more interested in talking to consultants and understand what is the process, what are the costs, what are the efforts for this certification. Since GDPR is not a certification, what people did initially, they just fixed their privacy policy and terms and conditions. Now we see more awareness and more prepared on considering GDPR from scratch, from the beginning in their applications.
What are the main changes that are coming in for medical device companies with this new regulation?
The most important aspect is that MDR extends the scope. So many companies, many applications that they didn't need any certification, they now need a certification class 2 or sometimes class 3 medical device according to MDR. And previously they were maybe class 1, so no certification, just self-certification. MDR extended the scope to digital health products, to software. MDR created also this new brand, so now you are certified as MDR. So, for example, new laws for reimbursement, like the DVG in Germany, they clearly ask for MDR certification. Also, MDD, you can also apply with MDD, but every single application will be MDR certified when applying to DVG from May, June this year. It created really, a new kind of brand, a new kind of requirement, and everybody will be certified according to MDR. New rules, higher standards in this year.
Higher standards in what sense?
Well, it improved a lot. For example, it included the software as part of the medical device. It's called medical device regulation, but actually, it includes everything. So everything related to healthcare. Software applications, apps, and so on. Whenever an application provides some guidance to people, some feedback, it should be certified according to class 2, at least, medical device. It mentions several times GDPR and privacy, for example, saying that the medical application or device has to follow also security, data protection, and privacy requirements that was not really that clear previously. And we have seen, for example, that certification authorities like TÜV or BSI are more and more demanding documentation on privacy and security. We have been invited by some companies to provide coaching to their quality assurance people to include in their documentation, in their quality management system, to include requirements on security and privacy, and to make sure that their applications follow GDPR properly.
Before we wrap up, just one last question. All eyes are on Germany this year regarding digital health implementation and regulation on national level, because a lot has been going on in the last year with your new health minister. what are your expectations? What's already happening? Can you be vivid with examples as of what kind of telemedicine or other solutions are already in use, and what are the upcoming changes that you expect in practice?
What I've seen, and we are in Berlin, so we are really monitoring. We've been monitoring what's really happening together with all the bodies involved. HIH, BFARM, and so on. We have seen that, a huge thing is happening. Previously, all digital health startups were struggling in finding in the biggest market in Europe, the German market, the German state. They were struggling in finding a commercial formula, let's say, reimbursement. What will happen in the next months is that the rules will be defined, so more precise rules and requirements for companies to apply will be defined. Those bodies are still working, and from May onwards, the companies will be able to apply and be approved to get the reimbursement according to these requirements. So we expect that in the next months, everybody will try to comply with the requirements on quality and also privacy and security defined by this German body and apply to get the approval. I think there will be the line for getting the approval will be quite long because many companies will apply. Small but also huge companies are building apps to get this approval for reimbursement. So everybody is seeing a huge opportunity.
You've been listening to Faces of Digital Health. If you like the show, do subscribe so you'll be notified about the upcoming episodes automatically, and leave a rating or a review wherever you get your podcast. Stay tuned.